Good morning. Today we'll talk about CMC arthritis, which is very common in many patients, especially after the age of 40. Although there is many youngies in 20s and 30s, they have the same problem. It's very common in female more than male, and there is many studies that says 12% of people after 40 they have CMC arthritis. So CMC is the joint at the base of the thumb, which is the carpometacarpal joint, and it just falling up there on top of the trapezium muscle, the trapezium bone. So with arthritis, there is many procedures, many treatments. Today we'll talk about the non-surgical treatment through rehabilitation, occupational therapy, and there is other solutions like steroid injections, but it doesn't last long. So after 6 months, maximum 9 months, patient will have the recurrency of the pain again. The last solution is surgical solution, wherein they just remove the trapezium bone. It doesn't have side effects though, and patient will regain his function within 6 weeks. So with CMC arthritis, the symptoms is mainly pain, especially with movement. So our role mainly is to strengthen muscles around the thumb and splinting as well. So patient could use the splint during the heavy duties. So exercise wise, you can start with exercises for each phalangeal. So you can block the MB and the CMC joints, and then you ask patient to do flexion of the IB and then extension. Can you do it? So patient can do this like 3 times a day, or as we used to tell patients, after each pray. So patient could do the exercises like 10 times, 10 repetitions. And this is also dependent on the severity of pain. So range of motion, this is number 1. So we'll move now to the MB joint, okay. And then you can free up the joints now, and then patient could do full opposition. And then if patient could tolerate doing some resistance exercises, you can use a TheraBand, and then you can do more resistive exercises. Can you do thumb opposition? So for a thumb spica out of an Orphe cast, I will cut around 40 centimeters for adult. If a patient has really a big hand, maybe you can go to 50 centimeters. And now I'm gonna put it to the water and then mold it on the patient. So this is the material. So now you can roll it around the patient hand. And now you need to position the thumb in a way that patient could use it. So you can ask the patient to do this. Till it gets cold. You can see from here as well. And then before it gets completely hot, you can cut here. And then now we'll take it off. And then we'll do the strap. وقفي. I'm just making a hole so I can make a slit up here. Okay, and this is okay. Heat gun الله يسعدك. The splint here a bit, and then the Velcro. And then from here, wow. So now I make the strap in that way because usually patients lose the straps and then they will come later, we lose the strap. So this is a good way, so the strap will not come out of the splint. So now patient will put it on that way, and then if you see here, so this is the way the strap is. So it looks good, and this is, patient could use it while she has a lot of pain or during activities that the pain stop them to do the activity, and it's easy for her now to can, so she can use all hand. So see you next video, hopefully in a week, so for more options of splinting. Thank you.